Morning, everyone. Welcome. So glad to have you here. A lot of new names and faces to me and a few familiar ones. And our goal this morning is to provide you with some information that allows you to help more people with our Healer Hemp products and to better understand the products and of course, to answer any questions at the end of the presentation that you might have. We just really want you to feel familiar with and comfortable with not just the products, but our whole approach to taking care of the customer and helping them get great results. And if there's anything you'd like to add to that, Brad, while I pull up the slide share, please do.
Hi, I just want to introduce myself. I'm Brad Foyer. I'm a co-founder with Dr. Sulak. I am CEO of Healer and oversee the business side of it. So just want to thank everyone for attending. And my email is brad@healer.com, so you can reach me directly. But look forward to going through all this with you today.
All right, so let's get started. Healer hemp products formulated to help you feel your best. We really take our work seriously. We're in this to help people. This is what inspires us. And thankfully, we've been successful. And perhaps you've noticed this with some of your customers or clients that our products are really helping people feel good. How is cannabis so versatile? These products in the cannabis plant, including those in what we technically refer to as hemp, can target the endocannabinoid system, which is named after the plant cannabis and has been studied extensively since the late 1980s and early 1990s and demonstrated to be this master controller of our human physiology. And so it often sounds too good to be true when people say, oh, cannabis can help with these mental health complaints and these physical complaints, and every different system in the body seems to respond to it. Oh, and it's good for inflammation and reproductive function and appetite and memory. It sounds kind of crazy, but the reason that we can get these kind of broad results in people with all sorts of different problems is often because we're interfacing with the endocannabinoid system. And then beyond targeting the system, many of the compounds in hemp have other targets in the body, which are similarly diverse in their capacity to improve health. So why Healer? This was developed by Brad and I and team because working in the medical cannabis field, we realized that we could be doing a better job than a lot of what was out there. I started practicing in 2009 and we watched the whole medical cannabis program and then the whole hemp industry develop in the previous decade and realize that it's not just the quality of the products, even though that's extremely important. It's how they're formulated, how they're extracted, what's the starting material of the products, and what's the education that comes with the products. These are the components that help people get great results and what we've focused on as a company. So I was using other people's products with myself, with my patients, with my family, and was really not satisfied. I needed something that I could trust, that I knew was higher quality, and that also contained the plant components that I was most interested in, especially the acidic cannabinoids. This is what really drove us to start the product line at Healer, because I was seeing great results with these compounds in experimenting with my patients and realizing that the vast majority of products out there just were fully decarboxylated and didn't contain any of the acidics. And so we're going to talk a little bit more about those later in this presentation. One of the things that we really wanted to focus on was honoring this plant and retaining as many of the therapeutic compounds as we possibly could. And so looking at extraction methodologies that would maintain these acidic cannabinoids, in other words, processes that wouldn't use a lot of heat or pressure, because that's what can convert the acidics into the neutral cannabinoids. And at the same time, processes that wouldn't lose some of these trace components, like some of the trace cannabinoids and terpenes and flavonoids that we believed were potentially ultra potent and very relevant to the therapeutic activity of the plant. Now, years later, we know more about this being true, that when we think about something like CBD or CBG or THC, that's really the tip of the iceberg. And below that iceberg, there's several, maybe even dozens of very similar compounds that are just slight variations that can make a really big difference. And these are compounds that aren't being tested for in most testing laboratories. We can't measure them outside of like expensive research equipment at top universities, and even then the opportunities are limited. But we inherently knew this, that the plant is giving us way more than we can detect and see. And so this is why we really focused on developing our own extraction and processing method that respected that, and we call that the Healer spectrum. This is a patented system that uses nanofiltration to maintain as many of these beneficial compounds as possible. And the nice thing about our system is that at the same time, it can remove anything that is unwanted, like big particles that might be related to pathogens or impurities, and also really tiny things that we don't want to maintain in the final product. We can get rid of those too and just select for this range of therapeutic compounds. So I'm really pleased with what we've been able to do from a technology standpoint. And as I mentioned, the acidic cannabinoids. So for those of you that don't know, I expect that most of you do, the cannabis plant itself doesn't produce things like THC and CBD and CBG. It actually produces precursors to these compounds called THCA, CBDA, CBGA, and the A stands for acid. These are molecules that have one little extra carboxylic acid group on it. And then over time at kind of ambient temperatures and much more rapidly at high temperatures, these acidic cannabinoids are converted into their neutral counterparts. So THCA turns into THC, CBDA into CBD, and so forth. We've suspected, as I mentioned, for years that these compounds are very potent and very effective. And now the research has demonstrated that we were correct. Just some examples like the oral bioavailability, how much of these compounds you can absorb orally could be anywhere from 10 to 50 times greater, looking at the acidic cannabinoids compared to the neutral ones, which that fact alone would mean, well, that individuals would probably need less of them to get a therapeutic effect. But it's not just that they're absorbed better. Once they are absorbed, they tend to act much more strongly in the body. And when I say much, we haven't measured this a lot in humans. There's a little bit of data to support this. But if you look at animal models, like rodent models that are very easy to measure, you'll see anywhere from 10-fold more potency in CBDA compared to CBD, all the way up to 10,000 times more potency. Giving rodents the same route of administration, the same model of measuring whatever disease process it might be, from seizures to inflammation to pain sensitivity. These acidic cannabinoids, especially CBDA compared to CBD, can do a lot of CBDA can do a lot of what CBD does, but much more strongly. We have a lot of patients and customers that have been taking CBD products and then added our CBDA to it and have just been really pleased by the results and the capacity for them to lower their dose and therefore save money. So we believe that these acidic cannabinoids are very important for the entourage effect. And so often now, a lot of cannabis products that are fully decarboxylated label themselves as full spectrum or broad spectrum. I'll just make a comment about that. First of all, any type of processing that can be done on cannabis will change to some extent the spectrum. Even the Healer spectrum, which is probably the best possible way to extract and keep all of those beneficial compounds. We're not going to try to deceive you. There are going to be some slight changes in between what's in that flower and what's in that bottle. Our goal is just to keep it as similar as possible. But when you're looking at other products out there that say full spectrum or broad spectrum, and they don't contain any acidic cannabinoids because they've been exposed to high levels of heat or pressure, that's just misleading. That's not true advertising. These acidics are absolutely an important part of this entourage or synergistic effect. So that's a lot about the products and the technology and what's in them. And then, of course, like, great products aren't going to do anybody any good if they don't know how to use them. And we saw this very prevalent in the cannabis and hemp industries, where you pretty much have to like take out a magnifying glass and a calculator to try to read a label and figure out what the heck is going on with the dosing. We wanted to make this very simple for people. So our products are just 1 drop equals just about 1 milligram of total cannabinoids. So really simple. If people want to count the number of milligrams they're taking, they can count the number of drops they're taking. We also make capsules for more convenience for people to put in their pill counters, and you get a little bit of a different onset, which we'll talk about later. These come in 10 and 20 milligram capsules, and then also our topical, which we've been just getting great results, and that's 20 milligrams of cannabinoids per pump. Those are metered pumps. So as you can see, we have this little mini dosage guide that's actually on every box because we know that not everybody's going to hit the QR code or pick up one of these booklets and get the more in-depth dosage guide. So we just want to make sure that everyone, even if the only thing they have is the package, they can still get great results. But what's inside the usage guide, I think is really helpful, and will probably produce return customers with great results if they actually use it. And we'll show you a little. Yeah, go
I
ahead.
just want to make a quick point. Just so everyone knows, the usage guide has been updated. So there is a new usage guide out, and these updates have come from all of our patients and our customers. And so you should be receiving the new usage guide. And just wanted to give a quick update on that. There's more pages added, and then what we're about to show you is included in the usage guide.
Thank you. And thanks for showing that, Carla. What you'll notice is the new one says CBG on the front. So the one in the picture here is actually the old version, and the you'll figure it out. The one that says CBG, it has more in it. So made in Maine, we make our own products. We're actually going to be visiting the farm where the hemp is grown today. We know the farmer. We work with him on what's going on with the soil and the seeds and the starting materials. We want to use really healthy plants that make healthy, clean medicine. And this is what makes our products, a part of what makes our products so good. So these are certified organic hemp plants. And they contain less than 0.3% THC, which is how they're able to qualify as hemp. Really beautiful to be able to go visit them. And we like transparency. So all of our products contain a QR code, a batch number, expiration date. You can follow that to our website and look up, find the cannabinoid, terpene, and contaminant results. And you'll see that our products are free from contaminants. There's a little bit of variation from one batch to the next, which I think is a good thing. Our bodies tend to respond well to slight variations, but in the big picture, there's a lot of consistency. So you get changes in small ways and kind of the smaller signal compounds, while the major components are going to be very consistent and dependable. And I think that's ideal. That's what we're looking for. So again, these all 3 of these products you see here, these are not going to get anybody impaired or stoned. I mean, potentially if somebody's super sensitive to THC and they drink a whole bottle of our CBD product, they might feel a little something, but probably not, because all that CBD in there is, counteracting the impairment of the THC. As I mentioned, organically farmed, lab tested, not just in-house, but by a third-party independent laboratory. There's no incentive for them to give us false results. We select our labs carefully and have worked with several to find a good one. These are vegan. There's no animal products, of course, no gluten, non-GMO. As I mentioned, these are all organic, the kind of stuff that I want to put in my body and offer to my family. I want to talk a little bit about refrigeration. As I mentioned earlier, the acidic cannabinoids will turn into their neutral counterparts slowly at room temperature. Now, because of that, we recommend that people keep the products refrigerated. And this is going to be most important for our acidic products to maintain their full potency. But one of the things that I want to point out is that the CBD product, the green bottle, it contains CBDA. We do that intentionally. It has a 6-to-1 ratio of CBD to CBDA. The reason we did that is because it makes the product stronger for most people. It makes them feel it more. And so over time, even that product sitting at room temperature will change a little bit. The content of CBDA and the other acidic cannabinoids will go down, and the content of CBD and the neutral cannabinoids will go up. Now, most people are going to go through one of these bottles fast enough that they wouldn't notice that if they kept it at room temperature. But if it's a product that's going to last, in their home for a couple months or longer, then definitely keeping in the refrigerator is going to produce the best results and keep it more stable. What I like to communicate to my patients who ask about this is that it's better to keep it at room temperature and use it than to keep it in the refrigerator and forget about it. Like, these are not going to change drastically. Like, if you leave it in a hot car or something like that, or walk around with it in your pocket all day, that can accelerate the change. But what's really important is for people to use it. So a great example of that is, people that want to take it right before bed, and they're laying in bed and they realize that things down in the refrigerator downstairs and they don't want to go get it. Well, that's a good reason to just keep it next to your bed and don't worry about this very slow change over time. So I hope that clarifies, and I'm happy to answer questions about it. But we've seen that it does take some time. A few days at room temperature isn't going to harm anything.
Just a quick point on that. Yeah, so from a production standpoint, we keep it for storage purposes at room temperature. And then at retail, we recommend our partners just keep it at refrigerator temperature for, before they sell it, just to keep it at its freshest. Oh, sorry, I meant we keep it all refrigerated.
Yeah, I was going to say, what are those huge fridges?
Yeah, I'm sorry. We keep everything refrigerated. I meant from in the production process to when it gets sent out.
Well, we have done stability tests, so we have long-term testing with these products at room temperature, watching how they change over time. I don't know if you want to comment on that at all, Brett. I mean, the slide says that they're naturally. Go ahead.
No, Dustin, I'll kind of paraphrase what you said is there's a lot of these minor components, like the acidic components, ones we can see and can't see, but we do know those will change over time at room temperature. So if you're going to use the product within like 30 to 60 or 90 days, technically it doesn't have to be refrigerated if you're purchasing a lot of product or you're selling it. To keep it its freshest, we recommend refrigerating it. So that's why. And that's actually unique about our products compared to pretty much all the other products out there that have any type of acidic component, or say they do, they don't talk about refrigeration. So we do see this changing over time.
Yeah, we've actually had some evidence from other products that claim to have acidic cannabinoids. They probably did at one point in their lifetime, but by the time they reach the consumer, there's very little to none of them left because it hasn't been refrigerated. And sometimes that supply chain takes a little while for the product to reach the hand of the user. Okay, I'm not going to go through this in great detail. I just want you to know, like, we're in this situation where our products work so well, it's hard to know which one to use for which person. And a lot of times, a single person could get great benefit from any of these three products, and so I don't want you to think like the choice is super crucial to success. Pick one of them up and a lot of people are going to get better regardless of which one. But of course, we're going to get better results if we can somehow, learn a little bit about the person, or if the person can kind of look at this chart and say, well, these are my top goals. Which product has the most check marks that correspond to what I'm really trying to achieve here, and just select that one. So you can look at this. This is all in that usage guide, so you can just flip that open and people can take a look and make their choice.
Great. One more point about the Find Your Formula. We our new point of sale materials. We have easels that are for your practice or for your store that can be also put up where your customers can easily see it. And so this was all developed based upon people wanting better direction. So we can send these out if you haven't received them, but these will actually stand up so that you can easily, walk through someone. And then, as Dustin said, yes, it's the new dosage guide. The usage guide opens up and has this directly in it for people to review.
Now, if any of you are wondering why do we use some of the wordings that we do, it's because this is a nutritional supplement. It's not a medicine. And so there's certain claims that we can't make. So like occasional head discomfort, I think a lot of you understand that we're kind of pointing towards something called headache, but occasional head discomfort kind of falls in this structure function claim that we're able to make with non-FDA approved medications. And I think we've done a good job of working with that language and communicating pretty clearly what these products can help with. And then the different delivery routes. So we have the drops, the capsules, and the topical. And for most people, the drops are going to be, well, I should say, when treating a person systemically, the drops are going to be the fastest way, and the capsules might take a little longer to kick in. But we have great results with the capsules. We use a capsule technology where it's really the same exact medicine. Everything that's in the bottle of oil ends up in the capsule, but in a way that doesn't make a mess or doesn't leak. We use these things called xyloids, which are like little tiny particles of silica, totally safe and benign in the body, but they disperse in the gut, spread out over a large surface area, and deliver that oil to the intestine very well. So the drops will have a quicker onset and likely the very best absorption. The reason for that is because people are able to hold it in their mouth for a little while before swallowing. So part of the dose will be absorbed through the mucosa, through the blood vessels in the mouth, and then the rest through the gut, versus the capsules, which are absorbed exclusively through the gut. And the other benefit of the drops is that people can really fine tune their dose, right? If they're using capsules, they're kind of limited to 10 or 20 milligram increments of adjustment. Whereas with the drops, people can see that, what's the minimal dose that I need to get the best results. And that's going to be more cost effective and less likely to cause negative side effects, even though very few people with any of our products are going to experience negative side effects. And then there's the topical, which probably is the fastest acting. I'm still surprised and impressed, by how quickly people respond after they, I give them a sample pump in the office and they rub it in while we're having a conversation. And 2 minutes later, wow, I can't believe how much better that feels. It's hard to believe. And by the end of the visit, 20 minutes later, people are really noticing a difference. So the topical is great. It absorbs quickly. It's not greasy. It does have some menthol in it, and so you wouldn't want to use it anywhere too close to the eyes or the nose or the mouth. But beyond that, it's just such an effective product. Hopefully, most of you have tried it.
Let me pause there for a second. There's a quick question. It was a great question. They want to know how much of the capsules are really being absorbed versus the sublingual, the drops. So from a scientific standpoint, we don't have a definitive answer at the moment because we don't have clear research that we've performed on both of those. So it's something that we want to do moving forward. Dr. Sulak, you want to go into kind of what your thoughts are, or which is the difference between absorption of?
Sure. Yeah, there's just a little bit of evidence in humans looking at the difference between cannabinoids that are taken in a liquid form via the mouth versus swallowed directly. We have some data on that from THC containing compounds, like the FDA approved medication dronabinol, which is just THC in a pill, versus its liquid version, which can go into the mouth, versus something called nabiximols, which is an oral spray pharmaceutical version. And so, we can look at that and get an idea of what might be happening with CBD. There's also animal models and tissue models of absorbability through these different types of tissue. And so we expect that the drops are getting absorbed better, but we don't have any what we call pharmacokinetic studies that prove this. So what that would mean is having people take one or the other and measuring their blood levels of these compounds every time interval, typically every 30 or 60 minutes throughout the day, and watching those levels go up and then come back down again. We haven't done that with our products. There is some human data that has looked at that with cannabis-like products. Like, for example, I mentioned earlier that the Cbda is much more bioavailable than the CBD. That comes from human data. Those were people that were either drinking a tea-like preparation that contains CBD and Cbda, or taking it in an oil form. And you could see the levels of CBD and Cbda in the blood over time, and the Cbda was just much higher. So we haven't done this for our products yet. That would be really nice to do. We're not making any claims that, our products are 80% absorbed or 90% absorbed. We don't know, but we know that enough is getting into the person to make a difference. And typically with our products, that's a lower number of milligrams than most other products that people have tried. Okay, so research. Now, even though we haven't done the pharmacokinetic research, we have done some outcome research with our product, with our original CBD oil drops. So this would be the 6-to-1 CBD to CBDA. And our product was sent out to 200 people who recorded their scores on well-being, anxiety, sleep, and pain. And so what you can see is that after just 1 month of using our product, and how did they use it? We sent them the usage guide, they read through it, they figured out their own kind of individualized dose, which is way better than what you'll see in most kind of studies where they just give a bunch of people a fixed dose. That fixed dose is going to be too low for some people and it's going to be too high for some people. But our method really allows people to individually tailor how they're taking our products. And so what happened over the course of a month? 90% improvement in well-being scores. 72% of people with anxiety had what was considered a meaningful improvement in their symptoms, meaning an improvement in anxiety that related to a change in their capacity to function. 63% of those that were having sleep problems ended up experiencing improvements in their sleep. That's a pretty good number, but as you can tell, it's not quite as high as the well-being or the anxiety. And then also for pain, 58% of those who took our CBD product for pain had clinically meaningful improvement in their symptoms. And again, that doesn't just mean that they rated their pain going from like a 6 to a 5 or something like that. It's a change in the rating that's significant enough to impact how they're able to function in their lives, which is, 58% is still pretty high. So we're really pleased with this. I expect that if we had tested our CBDA product, we might see even higher numbers, especially in the pain and perhaps the sleep department. And we'll talk about sleep specifically just coming up here. But again, I just wanted to focus on our topical, which contains CBDA and CBD. I want to point that out. Most topicals don't have CBDA. There's evidence from animals that CBDA gets absorbed very well through the skin. And as I mentioned earlier, it's more potent in the body. I think this is why ours works so well. Also, our product is potent. 20 milligrams per pump is a lot. You'll see a lot of it. So 850 total milligrams in this 1.5 ounce bottle. You'll see a lot of other products that are 1.5 ounces that might be 200 or 300 milligrams. So we put a lot more hemp cannabinoids in there, and we formulated in a way to really improve the absorption through the skin into the tissues where it's needed.
So one quick point I wanted to make is we're offering a sampling program for the topical, which is working really well, and it automatically happens. When you order the topical, we include one free one for every dozen that you purchase. And then it will be sample topical. And then we have point of sale materials that offer samples. So there's typically like 42 full pumps. And this just allows people to try the topical, experience it, either in the clinic or in a store. And then our feedback from the launching this program is it's really helping people experience the benefits and selling more of the topical, helping more people.
Yes, and I agree with that. And if you haven't had that experience, I encourage you to. It's really fun to just hold that thing out and people put out their hand and they rub it in and then make an exclamation a few minutes later. It's almost always people are really appreciating it in the short run. So I want to just go through the 3 products in slightly more detail and point out what they're best for. And it's so hard because all these products work for so many different things. But what we're learning from my patients and from our customers is that the people who prefer this product, the CBD product the most, are typically interested in more of the mental benefits, like feeling a more positive mood, a greater sense of well-being, to help them focus and feel alert and awake and clear-minded. A lot of people don't realize that CBD can be really nice for a THC hangover. So if it's somebody that likes to use a lot of THC in the evening but wants to clear their head in the morning, this would be the best one for that. And also for stress and worry or anxiety like symptoms. This product does help with physical complaints as well. I don't want you to think that it's not going to help with aches and pains or headache. It's very good for those things as well. But what we're hearing now is that the people that are gravitating to this are more often looking for these kind of mental benefits. The other thing about this product compared to the other two we're about to cover is that when combining CBD with THC, the CBD can limit the psychoactive effects of the THC. It doesn't erase them completely, but can kind of put a ceiling on them or dampen them down a little bit. And that's good for people that are very sensitive to THC. So if you have folks that would benefit from the therapeutic effects of THC but can't tolerate much, combining it with this product would be a way to widen that window in between the effective dose and the dose that causes side effects. And moving on to CBDA, this is the strongest anti-inflammatory of our products. Really good for physical symptoms. People that having aches and pains, whether it's in their muscles or joints or in their head. This is often most bang for the buck in treating those symptoms. But we have a lot of people that also report the CBDA helps them with their mental symptoms as well. And based on animal models and a little bit of human clinical data, CBDA seems like out of everything, it's going to be the most potent for treating nausea. Now, nausea is very easy to treat with cannabis. It responds well to THC and THCA and sometimes to CBD and also to CBDA. One of the things to know about CBD and nausea is that it can too high of a dose of CBD could make it worse, whereas the right dose could make it better. We don't think that happens with CBDA, so people can be more liberal with the CBDA. CBDA does not impact the psychoactive effects of THC, so not a great choice for someone that's looking to dampen down those effects. But for someone that really enjoys the psychoactive effects of THC and wants to add something on top of it to enhance its benefits, make a more anti-inflammatory effect and get some of these other benefits, this would be the right product for that person.
I just want to ask a quick question, Dr. Sulak. Can you just briefly go into kind of the low amounts and then also how people are using higher amounts of CBDA, what you're seeing right now, kind of those two areas?
Yes. So a lot of people are responding to surprisingly low amounts of CBDA, like in the 5 to 20 milligram range. We're getting great reports. For some of my patients, especially those with like stronger inflammatory disorders, sometimes if they don't respond at that low dose range, we'll crank it up into say like the 50 to 150 milligram range, and that's per dose. So that could be even 150 milligrams a couple times daily in those higher ranges. And it's not just me, there's other clinicians that I'm talking about this with around the world. We're seeing that CBDA, first of all, is well tolerated at these high doses, and that it can help patients that it doesn't help at the lower doses sometimes. So in cannabis, we usually say start low, go slow, but don't be afraid to go all the way. That all the way thing isn't necessary for most people because usually they get results at lower doses. But those that don't shouldn't give up. They could at least do a short-term trial of much higher doses to see if it's going to work for them. And then finally, our newest product, the CBG, available in 10 milligram caps as well. So this is our most relaxing formula. CBG is really good for anxiety, especially those physical symptoms of nervousness, like those fight or flight feelings. This is whereas the CBD or CBDA might act a little bit more on the psychological aspects of these feelings. The CBG is going to be more likely to act on the physical, and this is great. It's very important to kind of break that cycle. Like the mind can make the body anxious, and then the body can make the mind anxious, and it just goes around and around. And so this is a nice intervention to calm down that physical nervousness. This is seeming like our most popular for sleep. Now, we'll talk about that, but I think as a first line approach for someone with that kind of chief concern about getting better sleep, this is probably a good place to start. Um, I'm jumping ahead, so we'll save sleep for the next slide. It can be good for absent-mindedness and focus. We've seen a lot of people with nerve discomfort, nerve pain that are responding well to CBG. There's some evidence that it can help with digestive health. Go figure, almost all the cannabinoids can. This one especially for inflammation in the gut. And then there's some really powerful evidence, not just in animals, but also in humans, that CBG can help with skin inflammation. And just like the CBDA, this one is not going to impact the psychoactivity of THC. So for example, for someone that uses THC and has a great response, say they get mentally more relaxed and less anxious, but their physical body is still kind of doing that thing, CBG would be a nice addition. Okay, so first, sleep. Sleep is really important. If somebody's not sleeping, this should be the first target, as far as an outcome, a therapeutic outcome. And so how to choose, if it's just a broad complaint, like I'm not sleeping well and I don't know why, and I just lay there in bed awake, I think CBG is probably going to be the best bet. CBDA is probably going to be the best bet when they're laying there awake because they're uncomfortable. CBG could absolutely help with that too. It helps with discomfort, but CBDA may be a little more likely to be successful in that situation. So you can ask, why aren't you sleeping? What are you feeling while you're lying there? And then for CBD, what can I say? CBD can be energizing for some people. So it can actually make them feel more awake and alert. Now, most people that take CBD before bed will tell me that they feel awake and alert, but they close their eyes and they fall asleep, no problem. There are going to be some people that take CBD before bed and feel awake and they don't fall asleep. I'd guess that's about 10 to 20% of people. So not a lot, but those people that respond poorly to CBD could respond well to our other treatments. But I think if there's somebody that knows that CBD helps with their stress or anxiety or mental worry, and they're using it for that purpose during the day, and their response to you when you say, well, what's happening when you're not sleeping? And they say, oh, my mind is going and it's worrying about all the things from the next day or all my mistakes from today or whatever it is, CBD might be the best way to do that, to address those symptoms. Cannabis is not a hypnotic. There's no compounds in this plant that are going to put people to sleep. The way we use cannabis to support sleep is to remove the obstacles to sleep. So it really depends what that obstacle is. But if you don't know, or it's hard to identify what that obstacle is, CBG is the best place to start. So just brief comparison slides. CBD at low amounts can be stimulating. Oh, I forgot to mention this on the previous slide. Some of the people, let's see, I'm going to go back. Some of the people that get that kind of wake up effect from lower doses of CBD will get a sleepier effect from higher doses of CBD. So some, like if 10 milligrams is waking them up, 30 milligrams might put them to sleep, not make them fall asleep, but help them fall asleep by addressing whatever's in the way of sleep. So CBD at high amounts can suppress appetite and be more sedative for some people. Appetite suppression is a good thing for some people and a bad thing for some people. So just keep that in mind. CBDA, typically people are getting results with a lot less of it compared to CBD. And one thing to know about our liquid CBDA product is that it can be peppery. Like it's one of the targets of CBDA is the same target as capsaicin, which is the hot component of chili peppers. Our product is not as hot as chili peppers, but you get a little bit of that if you taste it. Some people say they really like it and appreciate it. I think those are the people that like, stronger herbs. And some people really don't like it, but usually even them, they take a little sip of water or a bite of food afterwards, and the taste goes away very quickly. And then CBG also seems more potent than CBD in terms of needing lower amounts per dose or per usage. And it's different. Like CBG has some overlap with CBD and CBDA, but it also has some overlap with THC, not the psychoactive effects, but some of the other benefits in the body. And it has some of its own distinct benefits. People should absolutely not assume that because they didn't respond well to CBD, they're not going to respond to CBG. We have a lot of CBD non-responders that love CBG, and also same thing with CBDA. So this is just straight from the usage guide that we want to help people personalize their dosage. Just find how many milligrams per administration per use, and then once they figure that out, they can see how long it lasts them and decide how many times they need to use it each day. Those are basically the two steps. So it can be really nice for people. Say they've got joint pain and they, find out that, like, I'm taking CBDA in the morning, and by the time I got up to 12 drops, I'm like really feeling a lot better. But that wears off at, say it's 2 o'clock in the afternoon. In that case, they would probably want to add a lunchtime dose. Or maybe it doesn't wear off at 2 o'clock in the afternoon, but they wake up the next day feeling really stiff and they wish that wasn't how they started their day. Well, that would be a good reason to have their second dose at in the evening or at bedtime to kind of cover them. So you watch for how long it lasts in people. And then we just give this simple chart to really make it easy for people to keep track of where they're at and what they're testing out. The reason we like people to stay at the same dose for at least 2 days before changing the dose is because days are different, right? Some people have one kind of a day one day and then a different day the next day. And there's just so many factors in our lives that can impact our symptoms and our feelings of well-being I think the minimum amount of data we need to determine how does this dose affect me is 2 days. And this is our response tracker. So we get much better results when people use this. So often people are taking supplements and not paying attention to what they're doing, and then just wondering when it's time to buy it again or not buy it again, what the heck happened. If people use this very simple worksheet, then they can figure out how the medicine is affecting them. And the secret is that this is going to actually help them feel better because they're going to be more in touch with themselves. More self-awareness is a really essential part of healing. And so we have people write in the date or time, what was the number of drops they took. And then we do this little thing called the inner inventory. And they write down their score on the inner inventory before they use that dose, and then a little while after they use the dose. So how is their breath, their body, their mood, and their symptoms? And so I just show this. This takes about 30 seconds for most people. It's so useful just to get a snapshot of how I'm feeling right now. So you take a deep breath, do it with me. And you just rate that on a scale from 1 to 10. How easy and smooth is that breath? And you do a little check-in with the body, a little check-in with the mood. And if there's a specific symptom that's being addressed, you can rate that as well. And you just write that down in this, and you'll see, wow, I took that dose and my numbers improved, or they didn't improve. I'm going to have to try a higher dose next time. And then just finally, some pearls for better results. Consistent and daily use is really important, even though people will have short-term benefits. Like some people, first dose, they notice something. That's a really good sign. If that's the case, they're still going to have more benefits a month later after consistent use. So these compounds in our products are not just providing short-term relief, they're actually changing the physiology and improving the capacity for homeostasis or balance, that they're improving the self-healing system. If people aren't getting good results, make sure that they've tested out some different doses and use the worksheet to really see if they're getting good results, so they don't have to try to remember. They can prove it to themselves. And if they've used one product for a month and it's not working, trying a different product is often effective. I think there's very few people out there that would find no benefit from all three of our products. Like almost everyone is going to find benefit from at least one of these products. Most people are going to find some benefit from all three of them. Using these products at the time or around the time of eating something that contains oil or fat can greatly enhance their absorption. There is some human data looking at the fasted versus a high-fat meal consumption of CBD, and the CBD itself can get absorbed 4 to 5 times better when taken with a fat-containing meal. So it can really get much more potent that way. And then people that, a lot of people love the topical for the short-term benefits they get. I've also seen people like use the topical very regularly for 2 to 4 weeks and then say they can stop using it, like that thing healed and it didn't come back. That's wonderful. Another thing to remember is that if the topical is helping locally, it's likely that a systemic dose is also going to help. It means they've got something going on in their body that responds to CBDA and or CBD. And so addressing that systemically, like that combination of topical and systemic, can be super powerful, especially for the topical responders. And then how about combining these formulas? What we recommend is spacing them out when people are testing them, right? We really like people to figure out and have like clear personal evidence whether this is helping them or not. And to do that, you kind of like have to do a therapeutic trial, figure out if it's working. And so to avoid confounders or confusion, like say somebody's using CBD in the morning and it's helping them, but they want to try a CBG. Sure, there's no harm in them just taking them together, but we think they're going to get a better picture of what the CBG is doing for them if they try the CBG in the afternoon instead of taking it right with the CBD. That's just one example. And that is all that we have for you today. And of course, we'll be happy to answer your questions. Yeah, I'll leave it there. Thank you so much for your time and attention.
So, Dustin, there are a few questions.
Okay, I'm pulling up the chat. Yeah, got it.
Yeah.
I got the
So,
chat up. Let's do it. So,
awesome.
okay, I see that one about how much is being absorbed. I think we covered that. How does the form change the compound's desired effects in regard to pain and stiffness? Yeah, so we addressed that a little bit. There's going to be a similar mechanism of action. It's just a question of, can the topical reach the tissues where it's needed? And then, that which tissues need the CBD or CBDA? Well, it could be more than one. Like using the topical might help with like some inflammation in the joint capsule. Maybe it doesn't get deep enough, into the circulation, into the deeper parts of the joint, but taking it systemically and having it travel through the blood to those tissues can be more effective. Every tiny little nerve, every little muscle fibril is connected to a capillary. Like, our blood is everywhere in the body. And so having these things circulating in the bloodstream, I think, is going to be most effective for kind of getting to that underlying condition. But this question was specifically about pain and stiffness. Yeah, great. It really depends. Is it systemic? Is it local? And typically it's both. I know CBDA shows highest efficacy for pain topically, but notice the CBD drops on the last slide were noted for pain and muscle stiffness, and not the CBDA drops. I might look back at that. I think we got CBDA on there for pain and stiffness, but I'm going to go to the find your formula chart. So we've got CBDA for pain and inflammation after physical activity, occasional sleeplessness due to aches, head discomfort, workout recovery. I think everything on the find your formula related to pain and stiffness is checked off for the CBDA, except for one that says minor aches. And I think what we're kind of pointing to there is that if you have major aches, you're probably going to want to really go for the CBDA. It's the minor aches. Like CBD does help with aches, but CBDA more powerful. So hopefully that's clear, and we're happy to have any feedback on that messaging if you have it.
Yeah, thanks for addressing that. That really helped. And I think especially for those that are dealing with like more chronic and severe issues with like the muscle pain, addressing it both through topically and orally probably is then the best method to make sure it's in that bloodstream, since we can't always tell topically. So I really appreciate you addressing that.
Thanks, Tiffany. Great questions. Clearly you've been working with folks, and I appreciate your feedback.
Thank you.
Do you think you'll ever have nano or liposomal in capsules, especially for more accurate dosing, geriatric or palliative care? So you know, when we mention nano in our technology, first of all, we're talking about the molecular size of the filtration, like these tiny little nanometer sized pores that we're using to filter and clean up and retain those compounds. The word nano is also used in cannabis related to the delivery method, meaning that something's been added to the cannabinoids to create these very small particles that then potentially have better absorption through the gut. And I've looked at all the data on animal and human absorption of these nano, or the other thing is liposomal. Liposomal is very similar. It just means making these little bubbles out of fat soluble substances that then can be soluble in water, like water-based substances like our blood. So these technologies tend to increase the absorption of cannabinoids by about 4-fold. That's what most of the data has shown. As I mentioned earlier, taking it with a high-fat meal increases it by 4 to 5-fold. So, I haven't seen anything from any of this oral delivery method technology related to cannabis that surpasses just taking it with food. If we find that, sure, we'll be interested in making it even more cost effective, right? Like that's the idea of increased absorption, increased bioavailability, is that you'll be able to take less of it and get more of it into your body and therefore get a stronger result. So we've already achieved that through our formulation. And then, the other thing is, if, these companies are using liposomal or nanotechnologies, well, those are expensive. They're charging more for the products. So now people are paying more pennies per milligram of cannabinoids and kind of getting, it's just a wash in a lot of situations, in my opinion. But if anybody is, seeing things with nano or liposomal and really impressed with that, I'm happy to hear it. And I think that these are technologies that are useful for other supplements that don't get this, market improvement when taken with a meal.
Yeah, I just want to make a point about nano. So yeah, as Dustin mentioned, we're using a mechanical process like a filter kind of to actually filter our extracts. The nano emulsions are really being used in the cannabis industry for isolated compounds that don't absorb very well when they're isolated or by themselves. So when you look at what we've done, and we've been doing this over the past 5 or 6 years, researching formulations and also looking at what formulas work and don't work with the patients that come into Dr. Sulak's office. What we see is when you have the original terpenes and you have these other plant compounds that we're keeping, those actually are helping, or the patients are, able to take less of the product. And so those are doing a lot of the work. And so, yeah, you taste the plant, but there's a lot of effectiveness in just retaining those original components, letting the plant do the work versus needing something to deliver it.
And we deliver our products with oil, which they're soluble in. Like trying to get CBD to dissolve in water is a little harder. Like a little bit of it does, but of course, some of these like beverage products, for example, they're water based. You're going to have to do some type of emulsion or nano type of method to keep the cannabinoids in there. We don't have that problem, but when it comes to cost efficiency, I'd say that that's our specialty. Okay, so next question from Morgan. Wouldn't it vary from person to person based off their gut health and overall health for absorption rates? Absolutely. Like, what I like to, mention some of that human data that showed that CBD taken with a high fat meal can get absorbed 4 to 5 times better. That was the upper limit. There were people in that study that took CBD with a meal and their absorption was just 50% better, not 500% better. So there's a lot of inter-individual variability based on their gut function. And that probably changes from day to day. It's a bit of a moving target. For example, if we're anxious, we might have less or more gut motility, or if we got poor sleep the night before or something like that. So it's a good point. But I don't hear about a lot of people saying that they're getting drastically different results with the same dosage, especially with drops. I have some patients that do have GI complaints. that experience more variable results with the capsules. And I think that points out the benefit potentially of some of this oral route of absorption. And if people are having erratic effects from capsules, then switching to drops is probably a good idea for them to try. Okay, I've noticed that CBDA has been the most effective for anxiety and depression, works with the 5-HT serotonin receptor, and has been a great partner to serotonin meds or helping clients get off SSRIs, SNRIs. Thank you for pointing that out. And I think that, brings up another question, which you often hear about in medicine, is this risk of using agents that affect the serotonin system together. There's something called serotonin syndrome, which is a very dangerous but extremely rare medical condition where people are combining medications that affect the serotonin pathways. They can get really hot and red and sick. I've never seen it in my practice. Most of my colleagues have never seen it. It occurs very rarely. We've had, lots and lots of patients using CBD and CBDA with antidepressants, as mentioned here, with great results in supporting their taper, if that's what they're trying to do to get off of those medications. So great point. Can you speak to why people get opposite effects with cannabinoids? Is it just a different biphasic therapeutic range for that person's biochemistry? CBG can stimulate some people to the point where they cannot sleep. So these opposite effects, these so-called bidirectional effects, are usually related to two phenomena. One would be the dosage range. So at a certain dose, they're getting one effect. At a higher dose, they're getting the exact opposite effect. That is kind of present everywhere in cannabis medicine. It doesn't happen to everyone, but it's very common. It's just one of the, working with a plant that interacts with this homeostatic system in our body, the system that has this great capacity to balance things out, right? Like if something is overactive, it can kind of bring it down. If something's underactive, it can bring it up. So that's the system that we're interacting with. And so just by nature, working with a system like that, you can see some of these bidirectional effects where different dosages are going to cause it to go like anxiety up or anxiety down, or sleep up or sleep down. The other cause of these opposite effects is going to be the differences among individuals. We've seen this in cannabis for a long time too, like THC dominant varieties. Everybody loves this one for sleep, except for, this person that uses that one in the morning because it wakes them up. I'm sure you guys have heard this before. It's just common. So I love that you've pointed out that CBG can stimulate people. I've had maybe one or two reports of that, so not many. So maybe this is like the third one, and it sounds like it's been more than one person. So that feedback alone is very valuable to me. I think that communicating this with people, hopefully I did a good enough job there communicating with people. I think folks that get the opposite of what they expect you could look at and see what's the dosage range that they tried, and if it seems like it's too high or only just a low end, then you can have them try kind of that other part of the dosage range, and then if they're still having the same result, then use it in a different way, right? Like maybe that person says, well, CBG is not helping me with sleep, but I love taking it in the morning because it wakes me up. Why, like, these compounds are just doing so many things in the body. In medicine, we're very used to single agents, that they're just one molecule, they have one target in the body, one very predictable effect. That's nice, for knowing what to expect, and that's nice for doing clinical trials and measuring things. But it doesn't work that well for promoting health, because we have all of these redundant pathways in the body, and just blocking one pathway, usually doesn't provide long-term effects. And then later, when people are trying to get off that drug, it can cause other problems. So we are choosing to work with multi-compound, multi-target medicines that are somewhat unpredictable. But what is predictable about them is their, broad capacity to help people and their incredible safety profile. So it's, if somebody's getting an adverse effect, it's usually not such a bad one. CBG was effective on bee stings. I love that. Thank you for reporting that. That's a great anecdote. I think CBG has a lot to offer skin. Another one about CBG effective in gut issues, skin, joint, connective tissues. Yes, I mean, CBG is amazing. I'm so glad we have access to that now. And I like what Jeff said, CBDA tastes like it's going to work, right? I didn't mention that earlier, but often the way I'll frame that peppery taste is that's the feeling of it getting absorbed. Like you wonder, is it getting absorbed from my mouth? Well, you can feel something happening there. It's interacting with your body, because it's not just a spicy taste on the tongue, right? It's not just a taste. It's actually a feeling more than a taste. And that feeling can be in the sides of the mouth and in the back of the mouth and in the throat. So like wherever it's touching that mucosa, it's creating that sensation. It's actually getting into the tissues and doing something there. We love doing 2 to 3 days on the same dose to get the best idea of how it's responding. Thank you, Marlies. Morgan says, this is so interesting, CBDA for opioid withdrawal. Want to know more? A lot of patients come in wanting to get off narcotics. So, I'll say I have limited experience with this, because in my practice, I treat a lot of opioid dependence and I help people get off opioids. But I have the benefit of using THC, which is an incredible agent for that job. It's a tough job to do. We want to use all our resources available to us. So, without access to THC, it's the CBG and I think CBG, like out of our 3 products, CBG might be the most important. The reason I say that is because one of the symptoms of opioid withdrawal are these dysregulated autonomics. So this is the part of our nervous system that we don't usually voluntarily control. And it has 2 divisions, the fight or flight side called the sympathetics and the rest and digest side called the parasympathetics. Well, one of the features of opioid withdrawal that makes it so challenging is this incredible activation of the sympathetic nervous system. So people get racing heart, they'll start sweating, they'll start feeling really anxious, but not know why. Like, and these are waves that come unpredictably. And during that discomfort, there's often a lot of focus and fixation on going back to the drug. And so if we can minimize that, I think that that's a really important strategy. So CBG may be the most important for helping with the acute withdrawal out of the hemp products. And then when talking about substances, I just want to point out the substance usually isn't the problem, it's the solution. There's some underlying problem. So if someone was using opioids, just pointing the finger at the opioids, that doesn't really help them. Asking the question, well, what were you using the opioids to deal with? And could there potentially be a healthier solution than opioids to that problem? So like if it's pain, maybe lean more towards the CBDA, or if it's anxiety, maybe more towards the CBD. So some ways to think about that. Recently, I've been able to get a few off opiates with CBD, CBDA, and low dose THC. Most don't go back to their pain management doctor. Thank you. God bless you. That's wonderful. So many people out there that need that kind of help. I'm totally convinced that Healer recommended dosages are way too high. I never exceed 0.25 milliliters, which is 2.5 drops. I've had patients tell me this. The above dose is approximately 10 to 12 milligrams. So I would never give a patient 8 drops to start with. So Jeff, I think we got the math a little bit off here for our products, because 8 drops would be 8 milligrams and 0.25 milliliters would be a quarter of a milliliter. Our products are going to be 50 milligrams per milliliter. So 0.25 would be 12.5 milligrams, not 2.5 drops. So we can talk more about that or open up that conversation. But I think I think it would be high if we were starting people up in like the 35 to 40 range. We like 5 as a starting place for our products. Marlies says that she notices nano more in these products for kids and drinks and things like that. Absolutely. And then she also shares the anecdote that it happens to me personally. I cannot use anything but CBDA in the evening. CBN makes me feel like I'm 4 cups of coffee. I've heard this a lot. This is probably more common for CBN to wake people up than CBG based on my experience, and have not been patient enough to test my dosing. Well, thank you for the honesty. I love the sharing. that's going on here. Great questions. And I'm open to any live questions or comments or anecdotes, anything that any of you would like to share. All right. Well, I think you've probably shared it already, and I really appreciate you doing this. You can tell I enjoy the opportunity to connect with you and answer your questions and help you do the work that you're doing. I really appreciate what you're doing. I'm sure that most or all of you are doing it because you enjoy helping people and enjoy the way it feels at the end of the day. And I'm thankful that I have the opportunity to make that work easier and more effective for you.